There's heart rate and there's heart rate variability. Heart rate is basically a measure of the beat of your heart over an epoch of time. So if your heart beats at 55, 54, 56, 55, we basically take those 5 numbers, divide it by 5, and give you an average number. And so that number will stay the same. Heart rate variability actually is the change or variation that occurs in between each beat. And it's a change in milliseconds. I mean, we're talking for a healthy heart rate variability, it's a change of 50 milliseconds, which is a very short period of time. But when you have more variability, you're healthier. And I liken it, my big example or analogy is using a rubber band. So if I have a rubber band that's 10 centimeters and I stretch it to 12 and stretch it to 15 and stretch it to 18, now all of a sudden go to 22, because I've built in some resiliency or elasticity in the system, the rubber band will be okay. If I take that same 10 centimeter rubber band and I go 15, 15, 15, 15, and now go to 22, the rubber band's gonna break. And so there's not that ability for the system to take in a stress. And I'm gonna say stress in quotes because that stress can be a lot of different types of things. Heart rate variability is a very interesting measurement because it's also a measurement that will stay consistent, that you can make better. It can be worse, but it's a very predictive of other types of problems. It's 96% predictive of a fatal myocardial infarction after a first MI if there's a decrease in heart rate variability after that heart attack, independent of any other risk factors. So it can be a very scary number because, you know, I've tested myself and my heart rate variability is not good. I'm like, I need to do something to change that. We do it with athletes, and when we see changes in athletes, and I've worked for anything from high school athletes on up to professionals, and the variability or change in that heart rate variability from somebody who's like a part-time or weekend athlete like most of us, as opposed to a professional athlete. Professional athletes say, can you make me 1% better? You're thinking 1%, but their heart rate variability is already so high that just giving them that little edge can make a big difference. Whereas with somebody who's a weekend warrior, giving them a little bit more actually translate into a lot more. For years, I had seen in my practice, and I'd seen from my mentors, changes in patients who were treated for TMJ or TMD type of issues. And some of these patients made these incredible recoveries where they had back pain, neck pain, they had trouble walking, and they would wear appliances and things got better, which I thought was amazing, but I always wanted to know why. And nobody could ever give me an answer. There was a lot of different discussions as to what possibly was going on, and I was looking for an objective way to measure. And I thought if I had something to measure, then I could actually follow and figure out a way to help my patients in a way that would be scientifically based, and I would be able to do it over and over and over again. There, I had a relative who was in the hospital. They said, I left my appliance at home, can you bring it in? And they happened to be hooked up to different monitors while they were there. I put the appliance in, and I noticed that everything started to change on the monitors. The bells started going on, the nurses came in, so I took their appliance away. And then everything settled down, and I said, the best way to check this would be to retest, and I put the appliance back in, and things changed again. So to try to be a good scientist, I did it about 20 more times. And I said, there's something that's going on here that we can possibly measure. So that started me on a journey of how do we measure it and what are the different things that we look at. One of the things that I look at when we talk about how we do our exams and what's different about what we see with our patients is that patients will describe things to us. And sometimes they're not describing the problem. I mean, it would be great if every patient came in and said, Jeff, I have X is my problem, because then we would know what to do. That's never the case. And so what happens is we have to judge on the different things that they tell us subjectively and then get objective measurements to basically figure out what's happening. If I have, for instance, this patient who's in my chair whose resting heart rate is 111 beats per minute. So if you imagine sitting in the chair and your heart is basically beating out of your chest, how would that feel? Well, she described it as feeling anxious. And exactly that's what's happening. It's like you drank too much coffee in the day, and so your heart is beating so rapidly. And so she also has muscle pain. that's higher on the left side than on the right side, which we saw on the surface EMGs. So now we're starting to get an image with the objective measurements and her subjective reporting, which was, I have pain in my jaw, I have pain in my neck, and I feel really anxious. Well, it's not that she's wrong. She's basically describing what her physiology is doing. So she had had a number of different treatments, and it's really not specific to just this patient. A lot of patients do this where they go through different things because there's a lot of health practitioners that can help people. But the question is, are we treating the problem or are we treating a symptom? So, doing things with body work and things like that can be very helpful, but sometimes we need other pieces to be put in. And heart rate variability gives us a common language that we can speak where we say, okay, this is what's happening physiologically. What can we do to get the physiology balanced? And it's an anatomical type of thing. At least that's what we do with our appliances, but they still need to have body work done, whether it's chiropractic, physical therapy, orthopedic, you name it, all these different things to make the patient feel better. Heart rate variability we can use for a number of different things. We, in these cases, when people have facial pain or TMJ type of issues, it can be very helpful because it gives us other information. I always tell people I live in New York. I can get to California just by driving, but I can get there a lot quicker if I have a map. If we can get somebody's physiology to be balanced, or basically if I can do something with a patient whose resting heart rate is 111 beats per minute, where I make an appliance and now it goes half of that, what will they tell me? They tell me, I feel less anxious. Have I done some type of great, talk therapy with them? No, not at all. I've just changed their anatomy. And basically by doing that, allowing them to breathe easier and basically calms the system down and decreases their heart rate. What heart rate variability basically measures is basically it looks at the it's the SA node in our heart, which is based on the baroreceptors and the chemoreceptors in our body. And that's basically how our body regulates. And that's basically based on the sympathetic nervous system, right? So if somebody can't breathe well, if I hold my hand over your mouth like that, what are you gonna do? You're gonna fight. You're gonna do something to get away. And that's a survival reflex because it's sympathetic activity. It's your fight or flight response. If now I do something where I take those hands away and you can breathe better, you're gonna feel more relaxed, right? So we decrease some of that sympathetic outflow. And heart rate variability is basically a measure of what happens with sympathetic activity. When we have high sympathetic activity, we have low heart rate variability. When we have high heart rate variability, we have low sympathetic activity. And interestingly enough, inflammation and heart rate variability are inversely related as well. So high inflammatory markers, low heart rate variability, high heart rate variability, low inflammatory markers. With this patient, we were fortunate that when we made the appliance, her heart rate basically decreased by almost half of what it had been. And this isn't over a period of weeks, this is over a period of 30 to 60 seconds. She also had a decrease in her muscle activity. And so the EMGs went from firing much higher on the left side to where things were even. And what happened? Well, I don't feel that muscle pain anymore. Well, I don't feel the muscle pain because basically the muscles have relaxed. But the bigger piece is that we drop that sympathetic activity down. And when that does, the body can relax and work more efficiently. And so the appliance is not, there's no chemical in it or anything like that. We're changing anatomy, and when we change anatomy, basically we're allowing somebody to breathe easier and allowing their system to work easier. Everybody is different. Some people need the opening where they just open vertical. Some people need their lower jaw to come forward. Some people need both. Some people, on a rare event, they could have to go back a little bit. Rare. But it's all individual. And what we do is because your physiology is your physiology, when we measure it, we're looking at your physiology against yourself. People often come up to me and they say, I have a heart rate variability of 60. Is that good? Well, what's it based on? How did we get that measurement? Who made the measurement? Where does that number come from? Because there's no distinct thing. What we want to do is we break it down into all the little pieces and say, this is what we're looking at. We know if we see this, that's a better thing. People can have headaches for many different reasons. Some people can have, they may describe something as a migraine headache. It may not actually be a migraine headache, but there are some migraine headaches that can be, there are vascular problems, there can be hormonal type of problems, and there are other that it's basically a muscle type of problem. Or it can be related to somebody who has problems with their jaw, because you have all these muscles that basically are on the side of your head, and basically when something is off, those muscles are pulling or tight, and so it can create pain on one side of your head. And so people can have this that goes on and on and on. Often migraines will be should be on one side of your head, and often will make you nauseous. And the interesting piece with migraines is that for some of those people, if they were to vomit or throw up, the migraine will get better, because it's almost a reset of the autonomic nervous system. And so taking that to the point where we treat somebody for a TMJ type of issue, if we get their jaw in a position where the muscles can relax, often that headache, which may have a muscle component to it, will feel better. We see changes of anywhere, I would say 10 to 15 beats, but this was an extreme sample. It was a very interesting sample because, going back to how I look at things, I am constantly testing my hypothesis to see if it's correct. Because if it's wrong, I want to change what I'm doing. So with this patient, I actually had somebody else measuring her physiology while we worked on her. And so they were measuring the physiology. I had no idea what was going on while I was doing what I do, which was the dental work portion of it. And then we saw the results after we were done, so I was able to see, that I didn't affect or have an effect on what the reading or the data was. So what we did with the patient was, she told us that she had an upper night guard made, and it made her feel more anxious, and it made her feel more uncomfortable. So trying to figure out what was going on, what we did is we measured her with no appliance, not an upper or a lower. We measured her with an upper appliance, and then we measured her with the new lower appliance that we fabricated. And we ran a trend report. And what we found was that with no appliance, her heart rate variability was here. With the upper appliance that she said didn't make her feel as good, it actually, her heart rate variability decreased significantly. And with the new appliance, it was actually much higher, than not only than the upper appliance, but from her baseline. People who have sleep apnea may have something where they have a measurement of what's called AHI, which stands for apnea-hypopnea index. If you have an upper appliance made and you have an AHI that's already there, it can actually increase your AHI. And there's different reasons that people have tried to think of why that happens. And it may be that the jaw is falling back, and when the jaw falls back, what do? We close off our airway, right? And I always make this in a very simple term, that it's like CPR. If I put my thumb under your chin, the first move for CPR, and put the thumb under the chin and bring your jaw forward, what am I doing? I'm opening your airway. If I push your jaw back, what happens is I'm closing off your airway. One of the interesting things about heart rate variability, especially doing it in your office, is that it's a non-invasive way to measure somebody's physiology, right? So we can do it in the office over patients' clothes and get good readings. And it's easy, non-invasive, doesn't hurt, and we get results.